Detoxification is a process which the person starting treatment for addiction to alcohol and other illicit substances will require to go through in order to enable the person to tide over the uncomfortable withdrawals that the person might go through. This requires hospitalization, this requires clinical care, and hence it is an essential part of the beginning of treatment. Now, there are a few steps in the entire detoxification process. Step 1 begins with admission into a hospital facility with the signing of a consent form, wherein the person, though he has come in voluntarily for treatment, should be aware of and what the entire treatment entails. And that is the signing of the consent form. The hospital will have a separate consent form for the person who gets admitted, which is the common procedure of the hospital. Step 2, after the person is admitted into the hospital facility, is a physical and mental evaluation of the person. By physical evaluation, it is a basic checking of his pulse, blood pressure, his temperature, his physical reflexes, that is a neurological examination that takes place. A mental status examination would be to just check his cognitive abilities. If he has come sober, if he has come intoxicated, then that will be tested later. Step 3 is a case history taking again to evaluate the current situation of the person, because many times if the client has met us prior to admission with the family, then the person will not tell us the entire truth of the substance use. So the possibility of additional substances that might have been consumed, or the quantum having been different from what was stated to us earlier, would probably be revealed to us in this state at the hospital, in this phase at the hospital, which could help us to assess what possible withdrawals the person could go through. A repeat withdrawal history is also taken that involves the case history. Step 4 is biochemical examination, that is blood tests that are taken in order to investigate if there are any underlying ailments that the person is suffering from as a consequence of the usage that he has had. I will elaborate on all these steps eventually. Step 5 is there is a psychiatric evaluation done by our team psychiatrist. There is a detailed homeopathic case history taken by me as a homeopath to arrive at a consequent remedy which will help as an adjuvant to medications that would be given to him even during the detoxification process. Medication and the physical management and the psychological management of the client in the hospital. This will be done through different intravenous fluids, nutritional supplements, and medications that are given. Step 6 is the final step of transferring the person from the hospital facility to the treatment facility, where he will continue treatment in an alternate life therapy program. So this entails all the steps that are essential to cover up the detoxification process. So the detoxification process, which can take anywhere between 7 to 10 days to 2 weeks maximum, ends with the person at least restituting himself or herself to a certain extent of balance physically and emotionally, and having become comfortable with his or her therapists in whom he would continue to be associating with, he or she would be continuing to be associating with in the treatment facility. And so from here the person is shifted to our facility of Anatta, where at Anatta we do not call ourselves actually as a rehabilitation facility, but we are an alternate life therapy facility where we provide a life which the person is always looking to live but was prevented from living simply because of the substance came into the way.